All right, we're going to pick up where we left off with carbon monoxide poisoning. CO2 reduces the amount of oxygen in the bloodstream. It actually displaces the oxygen in the atmosphere. All right, oxygen binds to what on the hemoglobin, or on the red blood cell? It binds to what? The hemoglobin. Yeah, I just answered my own question. Thank you for pointing that out. So, carbon dioxide actually has a greater affinity to hemoglobin than oxygen does. If you have those 4 hemoglobin receptors that have oxygen on it and you breathe in carbon monoxide, it will actually displace the oxygen off that hemoglobin, okay? The gas is odorless, tasteless, colorless, and non-irritating. Sources include furnaces, wood-burning fireplaces, heater, automobile exhaust, and barbecue grills. You will have initial signs and symptoms are kind of like getting the flu, but there's no accompanying fever, general body ache, swollen tender lymph nodes. You should consider carbon monoxide poisoning whenever you encounter unexplained flu symptoms such as headache, nausea, vomiting, and confusion, especially if the symptoms are shared by other people in the same environment. A late sign is they will have a reddish tint to their skin, okay? If you suspect someone has carbon monoxide poisoning, evacuate everyone in the enclosed space, even people who apparently have no signs and symptoms. Ideally, patients should be moved at least 150 feet away from the suspected source of the carbon monoxide into open air. All patients with carbon monoxide poisoning must receive medical care. Many can develop delayed neurological complications after their initial recovery. Transport immediately, even if they appear to be recovering. All right, Brandon's favorite, cyanide. It's found in many forms and can enter the body in a variety of ways. What form?
4 pounds of almonds.
Almonds. If you eat approximately 4 pounds of almonds, that's enough cyanide to apparently poison you. That's how Brandon's going to kill me. One almond at a time. All right, you can find cyanide in such things as rodent poisonings, silver polish, fruit pits, and almonds, apparently. It is a byproduct of burning plastic and silks. All right, cyanide poisoning in large doses can cause death within a few minutes. The patient may progress quickly from early signs and symptoms to more severe effects. Early signs and symptoms is headache, confusion, agitation, burning sensation in the mouth or throat, dyspnea, hypertension, the smell of bitter almonds. I think is where that came from. Or is it the almond thing?
It's salmon reeks, or cyanide reeks of almond. Something like that.
So it's not the actual almonds?
No, it's just for some reason cyanide smells like it.
It may not be fresh almonds, it may be raw.
Probably
It's
so.
uncooked.
What's the mechanism of action for cyanide? Like, how does it kill you?
I don't know.
What a good question.
Yep. Tell you what, I'll find the answer and let you know. Late signs and symptoms of those seen in large doses: seizure, coma, hypotension, pulmonary edema, cardiac dysrhythmias, cardiac arrest, and acidosis. All right, emergency care, scene safety, always scene safety. Remove the patient from the source or the source from the patient. Able to maintain the airway, administer high flow oxygen, non-breather or positive pressure ventilation, rapid transport with ALS assistance. All right, acids and alkali. Strong acids have an extremely low pH. They're commonly found in liquid plumbing, drain cleaners, and other bathroom cleaners. Alkalis have an extremely high pH. They are in the form of either a liquid or solid. They're also commonly found in the house in plumbing and drain openers. Acid burns on contact, causing immediate and severe pain at the burn site. The tissue often dies immediately, producing a protective layer to lessen further burning. Alkalis also burn on contact, however, it takes longer to recognize the burning sensation. Alkalis tend to burn deeper by continuing to burn through tissue for longer contact times because the burn goes unrecognized. Okay? Some of the signs and symptoms you're going to see is burning of the mouth, lips, face, hoarseness, stridor, signs of shock, abdominal pain. Emergency care. Ensure your safety and the safety of everybody else. Remove the contaminated clothing. Decontaminate the patient. Brush it off. Maintain the airway and keep pulse ox at or above 94% with a normal breather or positive pressure ventilation. And consider ALS for rapid transport. Hydrocarbons. Substances are found in kerosene, lighter fluid, glue. Who's at today? Glue. Micah. Okay. Cleaning agents, propellants, and other products. Man, the things you learn about each other in EMT class. The toxicity varies, and there is a risk of aspiration. Okay. Signs and symptoms. Patients who are most commonly poisoned with hydrocarbons are children under the age of 5. The toxicity varies widely and is somewhat dependent on the viscosity of the substance. The lower the viscosity, the greater the risk of aspiration and the greater potential side effects. Hydrocarbon poisoning can occur by ingestion, inhalation, and absorption. The signs and symptoms vary depending on the type and the route of poisoning. The patient does not exhibit any signs or symptoms upon your arrival. It is likely the patient will not suffer serious consequences as from the exposure. Alright, if you get there and they have been exposed, remove the patient from the environment, decontaminate the patient, get those particles, get the clothing, everything off of them that's been contaminated. Open and maintain the airway. Keep the pulse ox at 94 or greater. Use positive pressure ventilation if you need it, and rapid transport. Fentanyl, or wood alcohol, is a poisonous form of alcohol. And a variety of common products such as gasoline, antifreeze, windshield washer fluid, paints, paint removers, sterno, and other canned fuels, and shellac. Methanol is a colorless liquid. It's different from ethyl alcohol, also called ethanol, or drinking alcohol. Anybody know why? This one can kill us.
It's not natural.
Oh. Okay.
It's not natural about it.
Methanol poisoning can occur from ingestion, inhalation, or absorption. Children might ingest substances containing methanol alcohol accidentally. When ingested, it causes the liver to produce massive amounts of acid in the body. The onset of signs and symptoms of ingestion occur 40 minutes to 72 hours after ingestion. Alright, typically related to the central nervous system, GI system, and overwhelming acid in the body. Blindness can occur in as little as 4 milliliters. Emergency medical care is primarily supportive. Administration of ethyl alcohol, drinking alcohol, can prevent the methanol from being converted to an acid. So stop by the liquor store on your way. However, there is an antidote available. Rubbing alcohol is the most common form of isoproterenol alcohol. It is found in most households. And most household products such as cosmetics, degreasers, disinfectants, solvents, and other cleaning agents, such as hand sanitizer, which is the big thing now. Poisoning most frequently occurs by ingestion, both accidental and intentional. There was a lady on Dr. Phil one time that would drink the hand sanitizer to get drunk.
Tell her to do it now.
Huh?
Tell her to do it now.
Yeah, for real.
We have a lady that drinks mouthwash all the time.
What?
Yeah, she'll go around Walmart and all that, and then she'll pass out in the bathroom.
Holy crap.
Really?
Alcoholics might ingest as a substitute for drinking alcohol. Although this alcohol is more toxic than the other alcohol, but less toxic than methanol. Alright, following ingestion, the liver creates acetone, which has a major effect on the central nervous system, GI, and your kidneys. That just sounds, no. Alright, signs and symptoms occur rapidly, usually within 30 minutes following ingestion. Acts as the central nervous system depressant, causing respiratory depression. And just like everything else, you want to open and maintain an airway. Maintain your pulse ox at or greater than 94%, whatever means necessary, and rapidly transport the patient. Ethylene glycol is commonly found in detergents or radiator antifreeze, windshield de-icers, and coolants. Children are commonly susceptible to the accidental ingestion of ethylene glycol. The products are usually colorful and have a sweet taste. Therefore, children ingest the substance containing the ethylene glycol with no reason to believe that it's harmful. Alright, signs and symptoms occur in 3 stages. The first stage is neurological. You have uncoordinated movement, slurred speech, altered mental status, nausea, vomiting, seizures, and hallucinations. The second stage is cardiopulmonary. You have tachypnea, pulmonary edema, cyanosis, dyspnea, and heart failure. The third stage is renal. You have little to no urine production, or you have blood in your urine and pain in your flanks. Emergency medical care is supportive. However, administration of ethyl drinking alcohol should be considered. So stop by the liquor store again. Be prepared to manage seizures and respiratory arrest. Poisonous plants. Treatment includes scene safety, personal protective measures, and decontamination if any plant substance is still on the person's body. You should first ensure the airway, breathing, circulation status. Routine treatment for this type of absorbed poison is mainly supportive until you arrive at the hospital. Keep the patient from scratching the site, as this can cause a break in the skin, which can enable an infection to set in. This is your poison ivies, sumac, all that good happy stuff. Suicide bags, also known as exit bags, are a common form of euthanasia worldwide. EMS crews in the United States are encountering patients using suicide bags as a less violent method to commit suicide. The suicide bag method is simple, inexpensive, and made from materials and ingredients that are accessible to the general population. I'm not going to tell you how to do it, because I'd hate to be encouraging. Alright, Brandon is going to present us with the Poison Control Center jingle here shortly. These centers are staffed 24 hours a day, 7 days a week. That's a 1-800 phone number. It's like 1-800-222-1222. Alright, and you just call them, provide the patient's age, weight, condition, and the specifics of the poisoning. And they'll pretty much tell you what to do. Alright, after several hours of vomiting and diarrhea, this guy had the food poisoning, right? Warren feels weak and lightheaded, being from out of town and having no one to drive him. He calls the ambulance. Good for Warren. That's what a taxi's for. Although Warren's vital signs appear to be within normal limits, an orthostatic tilt test is positive, indicating he is dehydrated and has lost vascular volume. The EMTs transport Warren to the emergency department, where he receives the medication for his nausea and vomiting along with IV fluids. Alright, case study number 3. This is a huge chapter, and I feel like we should take a little break.